Wow. Titi, thank you so much. Can you hear me? Okay, so Titilola is joining us back. Just a bit of loading issues there. Okay, Titi, you're back with us.
Yes, I'm here.
Okay, fantastic. So if you are just joining us, this is a conversation hosted by EIE, that's Enough is Enough Nigeria, and we're looking at COVID-19 and domestic violence. You can use the hashtag Call of Duty or use the hashtag One Person. Earlier, I spoke to Kate Henshaw, and we had a conversation around the COVID-19 and, of course, domestic violence. And right now, I have Titilola Vivour-Adeniyi. She's the coordinator for the Lagos State Domestic and Sexual Violence Response Team, and they've been doing some fantastic work. So, Titi, before we went on the break, my question to you was about how many shelters are in place in Lagos State, and, of course, how the lockdown may have affected their operation. So you were just answering that question.
Yes, so I was saying as far shelters. So we've partnered with the Ministry of Health to ensure that survivors that need to have access to shelter services are tested. And so they're giving them preferential treatment in terms of speedy access to testing. And we've been successful in that regard. So we've done that, or we're doing that with the Ministry of Health. So let's not forget that some of these NGOs are actually essential services. So like the Mirabel Center, Warif, they fall under the health category. So they are still providing services. Initially, they had issues with passes or having a movement. They had issues with movement, but that was sorted out. So most of the NGOs have also done what the SVRT has done. They've taken their services online. The ones that have hotlines are providing services via the telephone. They're doing a lot of advocacy on social media. Some are doing advocacy on radio, form of jingles and all of that. So yes, NGOs are still working.
And as we were saying earlier, it's a collaborative efforts and all that, but funding also is a massive problem. And you can have as much legislation as you want to have. If people are not taking advantage of the laws, you find that they will not take the effect necessary. But let's really talk about the funding issue. So the DSVRT is funded by the Lagos State government. The NGOs are funded by donations and maybe possibly as well grants that they may get. But there has to be a lot more money. People don't seem to understand how financially, I'm looking for the word, how money heavy prosecuting cases or sheltering domestic violence victims or helping them with psychosocial support, how expensive it can actually be. So what would you want to tell people in terms of even donations and funding, and maybe just having them truly understand what it could cost for one person to actually try and leave a very violent domestic situation?
Yes, so if we look at getting a case to court, so let's look at a sexual violence case. So we're looking at police investigation, referring the client for medical attention, compiling the case file, getting to court. That can it can cost on average 10,000–15,000 naira per case. And so you have people that say, oh, I don't have money, I don't want to do case. They say things like that, yes. And people say, no, is it that you don't want to get justice? But sometimes justice might be expensive and people cannot afford justice. And so that's where government comes in. That's where NGOs come in. And I think we just need to encourage a giving culture. Abroad, they do it. They give to animals, give £2, £2
charity.
Yes, we need to encourage that culture. But I think maybe we're a bit, as a people, we don't really trust. So we don't feel that maybe the NGO or the government is going to do what it says it's going to do. But I think there are some organizations that have tested they can do this. And they are people of integrity, like Project Alert. They are amazing NGOs working in the community level that are providing support, going beyond the call of duty to ensure that people that need help are actually getting this help. So we encourage them to reach out to support and donate to these causes. Definitely.
Okay, Titi, I couldn't hear you. Can you repeat that one more time? Your last sentence.
I said that we encourage people. It's not only organizations. Individuals can also support. They can give to charities because these are charities. And some of them are not, they don't have funding. Some of them. Some people actually don't. Some NGOs don't have funding. Some are being funded personally from out of pocket just because of passion, dedication, and commitment to this cause.
Okay. So I know you've mentioned some of the NGOs that you work with, as well as Kate also did, but I think it's also a good opportunity for us to sort of appreciate the work that those NGOs have been doing. So who are some of the NGOs that you've been working with? And again, coming off that question about the trust issue that Nigerians may have in terms of donating to some NGOs, who are the ones that you know that their work has been transparent, their work has been exceptional, they've really done what they've set out to do?
Yes, so we have for domestic violence, we have in terms of provision of support, shelter services, we have Project Alert, we have God's Home Foundation.
Okay, sorry. I have a say hi.
Hello.
All right. I'll come. Okay, I'm coming. Bye bye. Sorry.
She wants to join the conversation.
What? She wants to join every conversation. Go ahead, please.
Yes, I was saying that for domestic violence, we have Project Alert, God's Home Foundation. They provide shelter services. Day Spring Ministries, I think, also has shelter services. For sexual violence, you have the Mirabel Center, the first sexual assault referral center in Nigeria. We have Warif as well. We have Chechayara. Chechayara provides forensic psychosocial support for children who have been sexually abused. So Chechayara is there as well. And then in Lagos, we have the Child Protection Network. Protection Network. So they are in the local governments. They are the community level. So they also provide support to survivors of child sexual abuse.
Okay.
So we have a lot of NGOs that are doing amazing work at the community level.
Okay, I'm taking some comments, but let me go. There's a comment before we went on that break to start a new one. And the person was asking, what do you do in a situation where someone comes to you and says they're facing domestic violence? You take them out, you're putting them through all this psychosocial support and trying to, help them. And then they say they want to go back.
Yes.
And how the person was asking, how do you break that cycle? And I think a lot of people also need to know that research shows that, number one, the most dangerous time for women and their children, particularly in domestic violence situations, is when they're leaving, is when they want to leave. And that on average, it can take some domestic violence victims up to 7 or 8 tries to even leave. So it's not as simple as just saying to themselves, I want to leave, and they go. There's a whole mental mindset that has to be taken into consideration. So how do you break the cycle with someone who comes to you for help and then goes back into a violent situation?
Let me just use this case scenario to answer that question. This happened when we just started DS Reality, late 2014. A lady came in, her left eye was swollen. She had just had a baby. The baby was 3 weeks old.
Wow.
So she came into the office and she was saying, oh, this is what happened. She was literally a crime scene, so you don't even need to talk much. I mean, we can see what is on you. So we immediately rushed her to the health facility in the secretariat for the staff clinic, because it was an emergency, and then we put her in touch with the hospital and all of that. Do you know that this lady came back to the office 3 days later and said, oh, madam, I'm so sorry, but I want you to
drop everything.
Hands off, my family has gotten involved, his family has gotten involved. And for that case, we got the DPO to actually go in, because we were so enraged. Like, how can you do this? This person just gave birth. The baby is 3 weeks old and she's coming out. So the DPO himself went to effect that arrest. And she came back and said, no, that who will walk my daughter down the aisle, So I said to her that, madam, Do you think that we're
Who
joking?
Who will walk her daughter down the aisle?
Yes. She said that. So I said to her, Madam, do you think we're joking here? And she goes, please, just forget I came. In fact, Madam, do like I did not come. And it was an eye-opener for me, because that was one of my first cases. And then I just realized the importance of psychosocial support.
Yeah.
If a person does not receive psychosocial support, counseling, any other thing you're doing, it's almost like government said I should do it, or my parents said I should do it. But when you open that person to receiving psychosocial, I stress psychosocial. I'm not talking about religious counseling. I'm talking about professional counseling. The person receives information. The person is better poised to take a decision. And irrespective of the decision that person takes, that person will run with it. The person will own it. As opposed to, oh, they said I should do this. They said I should do that. So I think my answer in short would be, in that kind of situation, we will not despair, because we know that these are the typical traits of some survivors of domestic violence, or victims.
Yeah.
So we will encourage psychosocial support, and our services are free. You just make yourself available. We pay the clinical psychologist. We'll monitor, we follow up. And then you reach a decision for yourself. We've had some that have actually gone back, and they called and said, oh, they'll be going for psychosocial support. And you know what? I'm better than this. I don't deserve this. I have my whole life ahead of me. All I want for him now is to pay child support. Provide maintenance. I want to go. Marriage is not by force. We have some that have received coping skills as a result of the psychosocial support. They have been empowered to communicate effectively, because lack of communication is one of the triggers of domestic violence. People are not communicating. They are talking, but they are not. They don't even know who they are married to. They don't even know the love language of their spouse. We had some male abusers that would say, I shower this woman with love. I buy her this, Louis Vuitton, Prada, and look at what she does. And the woman is saying, I don't want Louis Vuitton, I don't want Prada, I just want you to be there. I want you to talk to me. Don't come home and be pressing your phone. Spend time with me, let's bond. I can't even sit down. Some will say, Madam, it's because I'm in your office, that's why he's talking to me like this. That at home we don't talk.
So let me ask, because you bring up abusers now. Bayo Olukpande is asking, like, do abusers also get counseled, and have there been prosecutions? What's happening when the family is the one saying they want to drop it? Does the government go ahead and proceed with prosecutions? I know there are some cases in which the state or the prosecution doesn't have to have a complaining witness, but is domestic violence one of them?
Okay, so if after maybe we've done a mediation and we are able to expose them, the parties, to the need for, it's not just enough for you to say you want to remain together and you don't receive psychosocial support. Sometimes it's actually compelling. Government has a duty to protect its residents. And so we compel them to submit themselves for psychosocial support. We provide that service for both parties. And that service is also free for both the abuser and the survivor or the victim. So that's one part of the that answers part of the question. I'm sorry, what was the follow-up? There was a follow-up.
So about prosecution, if they say that they don't want the case to go further, does the state government continue prosecution?
Yes. So you know, a crime is committed against the state. So it's the state that has that derives the powers to say I'm prosecuting or I'm not prosecuting. But because we are survivor-centered, we do not want to do something that would further re-traumatize the victim or the survivor. So it is only in cases of public interest, especially where death is imminent. This is a potential murder case. Government has every right to stand its ground and ensure that we prosecute. And we have done that. We've actually had a case where the survivor became a hostile witness. I think you understand. You appreciate what that means.
I'm not surprised. In a way, I'm not surprised.
And they
it
said,
happens.
No, you are trying to government
ruin my marriage, ruin my life.
In court, this happened in court. So we just need to strike the right balance.
Okay.
If it's public interest.
Okay, so Titilola will be wrapping up.
Should be prosecuted.
Okay, we'll be wrapping up soon, but I also need to ask you in terms of post-COVID, what have we learned? Obviously, the preparation was not as good as it should have been, but then again, nobody was prepared for the pandemic to be at this level. So there is a bit of leeway we can give everybody in regards to that. But when you were talking about the preparation and the passes for essential workers, Project Alert, their handle was also saying, yes, that it took them a while for the government to see them as also being essential services. So beyond COVID-19, we don't know if we're going to hear that there's another 2-week extension or 1-week extension. We haven't heard anything formal as of yet. But what are the lessons in all of this for us? Because pre-pandemic, there was domestic violence. During the pandemic, there is domestic violence, and we're not eradicating domestic violence overnight. So what are the lessons going forward from here, not just for the state government, but also possibly for the NGOs as well who will work in the sector?
So I think for me personally, what has come to the fore for me is the fact that we need to decentralize our services. This idea of people coming all the way from, if you're in Badagry, coming all the way to Alausa,
yeah,
it's disheartening. So that has really come up strong for me, that we need to decentralize our services in at least maybe the 5 divisions. Well, we have in Ikeja, the other 4. Decentralize our services, make access to services closer to the people. In terms of medical care, sexual violence is time conscious. You have to be a survivor of sexual violence has to receive medical attention within at least 72 hours. So they can receive post-exposure prophylaxis, counseling.
Yeah.
We can preserve evidence. We can get the suspect if he's on the run and all of that. And so we need to truly decentralize our services, make the services accessible at the community level, at the grassroots level. And I think NGOs, we just have to adapt. I mean, this is something that we have never experienced, but we've, in the past 2-3 weeks, we've had several Zoom meetings. These are Zoom meetings that before COVID, we're trying to set up meetings and you have to cancel because this person is not available. But now we're Zooming. Every other day, we're having meetings, we're taking decisions, we're trashing out issues, we're doing case conferencing, talking to responder agencies. So yes, so I think the time for us to take advantage and leverage on technology is truly here. There is no system that can address it.
Go ahead, don't worry.
There's no system that can address issues without taking advantage of technology. And I think COVID-19 has really shown that we need to leverage on technology. We have a USSD short code that you can report domestic and sexual violence. But we need to do more. It has to be on all the major networks. We need to be able to identify where the person is calling from, to literally look at the heat map and identify the local government, pin it down to the house if possible. And technology can do that for us.
Okay, so as we start wrapping up, I had Kate mention the NGOs that she's aware of as well. I'd want you to make sure you give out your phone number, the contact information for DSVRT, and then of course again just list those agencies or those NGOs that that people can go to if they find themselves needing any service or calling right now, even if it's just for them to quickly Google or follow them and send a DM, so that those services they can still get them if they need them during this time.
Yes. Okay. So for domestic violence, sexual violence, you have WRAP, Women's Rights and Health Project. They're actually at the community level, particularly in Alimosho. They have been doing amazing work in terms of providing support services for survivors of domestic violence. For sexual violence, you have the Mirabel Center, you have Women at Risk International Foundation, you have Project Alert, you have God's Home Foundation, you have Child Protection Network, you have Tonya Bruised But Not Broken. You know what? I could actually send...
Okay, we'll do that. So we'll have EIE post the list. Yes. On Twitter as well, because I think it's important as part of follow-up for this conversation. We don't know the situation of anybody who might be listening. This could be an avenue for them to get that necessary information. Now, quickly, somebody was talking about community, and we talked about community leaders earlier, I think it was. But in terms of, I know that DSVRT does some form of education. I think at the secondary school level, there it is. Can you just expand on that more? And what exactly are you doing in terms of getting information to the communities and sort of changing the narrative around domestic violence and sexual violence, as it may be?
Yes, so we actually do work with primary school children, secondary school children, and university students. So we have different modules for each of these groups. So the child protection, children have to take ownership of their own protection, right? And this is as envisaged in the Child Rights Law. So we need to empower children with information. How do you set boundaries? How do you good touch, bad touch, body parts, all of those kind of things. We do that via peer learning. And then we have publications actually in animation. We actually have a book for primary school children or children below between 3 to 7 years old, so they can. It's easy to read. It's colorful, and we pass the message on domestic violence and sexual violence. And then for university students, we're always very excited by this. So we actually take advantage of the orientation week. Because studies or research has actually shown that freshers are more at risk of falling prey to sexual violence, especially on campus. So for like 4 years, we've partnered with universities in Lagos, including the polytechnics, to come in, engage the students, give them, we have like a small handbook of, just things to look out for and services available to them that they can take advantage of. And we do this routinely. And then just basically ensure that this message continues to remain at the fore. Engage religious leaders. Religious leaders are truly gatekeepers. You will be amazed that a woman will listen to her pastor or her imam more than she will listen to you as an NGO or as a government
I'm not surprised. I'm not surprised.
I had a lady that said, I'm just waiting for my pastor. My pastor is going to tell me what to do. I said, oh, wow.
My pastor is going to tell me what to do.
Yes, that my pastor is this. So since 2 years ago, we have awoken to this fact that religious leaders are powerful in shaping this narrative. And so we've been engaging them. We've actually organized several trainings for them on domestic violence. It's not everything you must settle and use the Bible to say, this is what the Bible says, the Lord hates divorce. You know. First, remember that domestic violence is a crime. Yeah. It's a crime, and it's a crime against the state. And every domestic violence case is a potential murder case. It can be the last push or the last shove. So as a religious leader, be responsible with the mandate and the responsibility that is given to you to properly respond to to a member of your congregation that is experiencing violence. And truly, since that engagement, we've actually had religious leaders refer cases to the office that we've been engaging this couple, but we feel that
it needs another level. It needs a higher level in this case.
We need you to come in, and it's been amazing, and we just encourage other religious leaders to do that. And then we come in, we go to churches, we go to mosques to engage the members of their congregation. Yes.
Fantastic. All right, Titi, I'm going to let you go because we can go on and on about this. This is also an area that I'm very interested in. We've had, I think you've been to my radio station when I was on radio for like at least 3 times. We did a lot of things with the DSVRT, and I absolutely applaud the work that you do. And I really, really, really hope that we see much more legislation across the states and across the federation, and as well as many more states picking up the Lagos example to domesticate departments and agencies such as your own to deal with the issues around domestic and sexual violence. So as I ask it, I'll ask you, we don't know who's listening, we don't know who's watching, but if you were to speak to somebody out there who is a victim, who finds themselves in that situation right now, what would you say to them?
So you are not alone. You are truly not alone. You are believed. We believe your story. We believe you. Speak up, speak out. The greatest power you can give to your abuser is your silence. Yeah. Speak up, get your power back, and report. Report and get help. And if you're a perpetrator, listen. Be aware that these are crimes against the state. And definitely, truly, the arm of the law will extend to you, either during the lockdown or post-lockdown.
All right, thank you so much, Titilola Vivour-Adeniyi, coordinator for the Lagos State Domestic and Sexual Violence Response Team. We really appreciate the work you do. Project Alert, WARIF, Maribel Center. I know I don't know all of them, but all of these NGOs who dedicate their time to helping women and children in these situations. We see you. We hope to bring more attention to the work you do, and of course, hopefully be able to laud it and get more donations and grants and whatever it is to be able to do more. Thank you so much for your time. Kate Henshaw is still with us. Thank you, Kate, as well for joining us. EIE Nigeria, thank you so much for giving me this platform to have this conversation, and I hope that someone out there somewhere, even if it's not you and you know someone, please spread the information, share the information with someone that you know who might need it. And everybody is a mandated reporter. You see something, you say something. So please, let's keep that in mind. Thank you so much, everybody. Good night. Have a great night. Echo lockdown. Oh.
All right.
Bye-bye.
Bye. My regards to your daughter.
Bye. Oh, yes, no problem. All right, guys, thank you so much for joining. Until next time, whenever EIE lets me do this again, you guys have a great night. Let's remember we are in Lagos. If you are in Lagos, do not go outside without your mask at this point in time. That is the legislation. Please remember, cough into your elbow if you have to cough. Remember to wash those masks, the reusable ones. Wash your hands. Together we can, of course, conquer this, and we can also make things better for women and children and men out there who might be victims of domestic violence. If you see something, say something. You guys have a good night.